Hello everybody, and thank you for joining me today. My name is Adam Holbert. I'm a sales manager here at Schloss & Fleming. Wanted to go over Medicare Supplement Plan F and what's going on with that. I'm sure a lot of you have heard it's going away. When is it going away? Who will be able to use Plan F? And who will be able to not access Plan F? So I thought it was very important to go over that today. And I think I will be able to make this a lot more clear for you all. So again, thank you for joining me. Today on the agenda, we're going to go over a brief summary of what Medicare Supplement Insurance is. I'm sure a lot of you already know that, but we do have some agents that are on the webinar that have just started into the Medicare market. Some have done other insurance and are now venturing into that senior health market. And I'm sure a lot of you have been doing this for a long time. So we won't be on that subject very long, just a brief summary. We'll go into Plan F. We're going to go into why the plans are being discontinued, who exactly it will affect, some considerations for plan choices, some strong carrier candidates, and we'll go over some low rates. So let's jump right into it. And I wanted to do a brief summary on Medicare supplements. So there's no difference between Medigap and Medicare Supplement. I'm sure you've heard both terms. Medicare Supplement and Medigap are synonyms for the same type of health insurance. They have the same meaning. So these plans are offered by private insurance companies and are designed to help pay your out-of-pocket costs for services covered under Medicare Part A, like your hospital insurance, and Part B, your medical insurance. So for example, some Medicare supplement plans might pay for all or part of your Part B co-insurance amounts. So Medigap or Medicare supplement plans work alongside Medicare Part A and Part B. So your client will need to be enrolled in both, and they must also live within the plan's service area. Okay? So moving forward, every private insurance company that offers Medicare supplement plans must follow federal and state laws designed to protect consumers. The policy must be clearly identified as Medicare supplement insurance, and insurance companies in most states can only sell standardized Medicare supplement plans that are identified by a letter. So as you can see here, there's 10 plans available, A through N there, as you can see. The only difference is the name of the carrier and the price of the plan. The benefits are all the same. So a G is a G, an F is an F. The only difference is what the carrier name is that offers it and the premium. Okay? So like I said, the standardized plans have the same set of basic benefits regardless of whether you buy it in Vermont or in California. If you have a Plan F, if you're in Vermont, you're going to have the same benefits as someone that has a Plan F in California. You just might have it from a different carrier and pay a different premium each month. Now I will note, anybody that's in Massachusetts, Minnesota, and Wisconsin, you all know they have their own standardized plans in those states, so it works a little differently. So now let's go into Plan F and talk a little bit about that. So millions of Americans choose to supplement their original Medicare benefits with additional coverage that helps to cover the gaps. So Medigap plans in America are standardized, just like we talked about, and for decades, Medicare Plan F has been a top seller. So Medicare Supplement Plan F, like I said, the most comprehensive of the standardized Medicare supplement plans available in most states, largely because it covers all of the deductibles, the co-insurance, and co-pays that would normally be your responsibility after original Medicare pays its share. So beneficiaries insured with a Plan F policy pay nothing for doctor visits, lab work, surgeries, hospital stays, and much more. So this type of first dollar coverage provides huge peace of mind to Medicare recipients as they age because their costs are predictable. So if there's an illness that requires extensive treatment, they don't need to worry about what kind of bills will be showing up in their mailbox. However, in 2020, this will be changing because Plan F and Plan C are being discontinued. But I want to go into who exactly this will affect, okay? So first, let's find out why they're being discontinued. In 2015, Congress passed the Medicare Access and Chip Reauthorization Act. So part of this legislation will outlaw the sale of Medigap Plans on or after January 1st, 2020 that pay for the Part B deductible to a newly eligible Medicare beneficiary. So in 2018, the Part B deductible is $183. This year, 2019, that Part B deductible went up $2 to $185. So since Plan C and Plan F both pay for this deductible, they will no longer be available to new beneficiaries. The reasoning behind this law, and this is important, the reasoning behind this law is that Congress doesn't want people to have plans that pay for literally everything, because that might encourage people to access medical care more often. So think of it this way, individuals who know that they must pay for their own Part B deductible once a year might think twice about visiting the doctor for a minor ailment. So fewer doctor visits equal less spending by Medicare itself. So the important part here, who will this affect? So if your client qualifies for Medicare on January 1st, 2020 or later, they will not be able to buy a Medicare supplement Plan F or Plan C. If your client is eligible for Medicare before January 1st, 2020, they are able to buy a Medicare supplement Plan F or Plan C. If they already have a Medicare supplement plan, if someone right now is 65 years old or 68 years old and they're on Plan F or Plan C, they will always be able to keep that for as long as they live. So I just want to recap and make sure that it's perfectly clear. Anyone that is currently on a Plan F or a Plan C, they're going to be able to keep that plan or choose that plan at all times in the future. Anyone who qualifies for Medicare on January 1st, 2020 or later, they will not be able to choose the Plan F or Plan C. So here's some considerations for plan choices. So one silver lining in this change is that people who are already insured by Plan C or Plan F, like we said, are going to be able to keep their coverage. It's only the new enrollees who will not have the option to buy it. Like I said, anyone turning 65 after January 1st, 2020 will not be able to buy it. So what this does, it leaves many current Medicare enrollees with some decisions to make. Do they enroll in Plan F now so that they can keep it, or do they switch out of Plan F before it's discontinued or has higher rates? So the beneficiaries who stay insured on these plans could find that after 2020, those rates for the plans might begin to creep up. You know, that's certainly possible because as the block of insured individuals will be aging with no new and younger policyholders joining the group. However, people with Plan F will still be able to shop their policy when rate increases happen. So if they find another Plan F with better rates, they can switch if they are able to pass the medical underwriting to do so. This will probably not affect everyone, but I do want to go over it. In some states, like California and Oregon, individuals with Medigap policies have a short annual window for 30 days after their birthday to change to an equal or lesser Medigap policy without any underwriting. So some beneficiaries, they're choosing to leave Plan F now and enroll in other Medigap plans that are not going away. Plan G is a great example. It covers all the same services that Plan F does, except for that Part B deductible, $185. So although the Plan G policyholders will have to pay that $185, that Part B deductible, if they incur any medical services, the premiums for Plan G are often considerably lower, making that a plan a very good value. So I'll give you an example. Say, for instance, we have a Medicare Plan F that's $150 a month, and we have a Plan G that's $125 a month. You might say, well, I want Plan F because I don't want to have to pay that Part B deductible. Well, think of it this way. If you went on to the Plan G that was $125 a month, you save $25 a month, which comes out to $300 a year, okay? You take the $185 deductible from $300 and you're still ahead $115. So Plan G is the better value there. Saving money with still paying the deductible. And like I said, it's the same exact benefits as Plan F. You're not losing any benefits at all. Now, let's talk about some strong carrier candidates. So Lumico, Union Security, CSI, Western United. These are very competitive Medicare supplement carriers that offer low rates for Plan G. These carriers actually come with better marketing programs, and they also have higher commission rates. So it's basically a win-win situation for you as the agent and for your clients. So I just want to give you an example of some of the rates that these strong carriers offer. I'll give you an example. Union Security, you can get a Plan G rate for $86 in Iowa. Western United, they offer a Plan G rate as low as $96 in Utah. Lumico, we're talking $89 for a Plan G in Indiana. And those are just some. Like I said, you can always call in if you want to see if those carriers are available in your state and what the rates for the Plan Gs are. We have our quote engine that we access and you can access totally free. So any questions that you have, I hope that I went through everything thoroughly and now you have a complete understanding of what's going on. But if there is any questions, do not hesitate. Give us a call. The number is right there, the 800-562-7733. Let us know where you're located, because we have regional teams that focus on certain areas, so we're able to provide you with great information and knowledge on the products available in your area. I appreciate you guys being with me today. So, as always, we're always here to help. Always picking up the phone. Let us know what questions you have, and we look forward to hearing from you. Thanks again for joining me.